Hello, my name is Michaela Moran, and I'm a student in the Discovery Lab. I will be presenting my research on antibiotic potential of methyl glyoxal on Salmonella typhimurium that I conducted this semester. There has been a dramatic increase in antibiotic resistance, so much so that antibiotic-resistant infection is projected to have more deaths than cancer by 2050. This has mainly occurred due to the fact that the easiest to discover antibiotics have been discovered, leaving the remaining drugs to discover requiring a lot more time and resources. Typhoid fever is a antibiotic resistant illness that is prevalent in places where water treatment is lacking. This is a deathly illness, and as it is antibiotic resistant, is a major issue. Salmonella typhimurium is a lot more easy to work with as it is safer. It only causes food poisoning in humans, but it does cause typhoid fever-like symptoms in mice. Therefore, it makes Salmonella typhimurium a good model to observe gram-negative bacteria and the effects of antibiotic on it. Methyl glyoxal, or MgO, is found in high levels in Manuka honey, and it is a compound that has been proven to have antibiotic-resistant properties, preventing movement of flagella on both gram-negative and gram-positive bacteria. With this information in mind, my group decided to test if MgO and if organic compound present in high quantities in Manuka honey will exhibit an antibacterial effect on Salmonella typhimurium via killing or inhibiting its growth, as well as MgO will demonstrate a diminishing antibacterial effect as the concentration of the compound tested decreases, indicating that it functions like a drug. In order to test our hypotheses, we began by preparing 5 1-to-10 dilutions of MgO stock. We then prepared a 96-well plate, comparing our dilutions to a positive control of ampicillin, which is a known antibiotic, as well as a negative control of H2O. We then tested this 96-well plate in a spectrophotometer, reading it at 620 nanometers. A high absorbance suggests bacterial life, whereas a low absorbance shows bacterial death. So as can be seen from this first graph, ampicillin was an effective positive control, and water was an effective negative control. So comparing our results, we were able to observe that MgO did kill Salmonella up until 0.001 micromolar concentration. So we then wanted to narrow in on this range between 0.01 micromolar and 0.001 micromolar to see more specifically where MgO was effective. So after testing these concentrations, we were able to statistically analyze that MgO did still kill Salmonella up to about 0.004 micromolar, showing its use as a drug and effectiveness in killing bacteria. We then also conducted a bactericidal versus bacteriostatic test with a time kill assay. And while we were only able to conduct one test of this, there was growth, which would indicate that MgO is a bacteriostatic antibacterial agent rather than bactericidal, but further testing will need to be done on this to verify. Other future directions include testing in vivo to simulate the environment, as in vivo environments do differ greatly. If these tests are successful, we would then be able to move forward into clinical trials. We would like to thank our principal investigator, Dr. Corey Detweiler, for this opportunity, as well as we would like to thank the Howard Hughes Medical Center and the University of Colorado MCDB department for funding. We'd also like to thank Dr. Pam Harvey, Gretchen Hoyer, and our TA, Hallie Steiner, for their constant support and knowledge. Thank you.